Hello, medical terminology students. This week we are focusing on the lymphatic and immune system, and so chapter 12, and we will also be doing chapter 19 this week, and that has to do with aging. And the term for age, it means senescence, which means it means old age. So let's do chapter 12 about the immune system or lymphatic and immune system. This chapter starts on page 396 in your textbook. And we first come off with a diagram of the lymphatic system, and you can see the different organs that are in the lymphatic system, along with all of the lymph vessels. And if you look back at your slides in the cardiovascular system, you'll see that the lymphatic system, it correlates with the cardiovascular system. All right, functions. This here is just a little where the veins and the arteries connect, shows you how the lymphatic system kind of intertwines with the cardiovascular system. And the functions are absorption and removal, because obviously you have these ducts, so it's going to help with taking the bad things, bacteria or antigens, and then getting them out of your system. Some terms that have to do with the lymphatic system and in the immune system. So obviously we can look at these terms and we see that the first root word or combining form is immune. It's either immune or immuno. So obviously, if we look at the term immune, it's going to mean the same thing as in an immune response where we wouldn't be able to get that disease. So let's go for immunity and then immunize, immunology, immunologist, immunization, and immunoglobulin. Same root word or combining form, just different overall meanings. All right, here we have a lymph cell. It shows you kind of what they look like. Oh, sorry, no, not a lymph cell, a lymph node shows you what the lymph nodes look like. And within the lymph tissues and cells, we have different things that fight off infections, such as T lymphocytes, B lymphocytes, null cells, macrophages, and they all have different jobs in our body in order to protect us from getting sick or killing the bacteria or fungus or whatever it is we're experiencing, getting it out of our system. Here's our lymphatic organs. A spleen, here's the combining form for spleen, or tonsils, adenoids, and our thymus gland. Where differences you can see, take a look at spleen and splenectomy, tonsil, tonsillectomy, phagocyte, phagocytic, and phagocytosis. Spleen has the two E's, but you take the one E out when you spell it in splenectomy. Tonsil has one L, but you add an L in the tonsillectomy. So again, just some different spellings that you just have to memorize them. All right, here is the immune system. These are the functions of the immune system. I'll let you read this. You can read that in your book of, excuse me, of the different functions. And now we come into some terms that you might see in this chapter: antigen, mutation, resistance. And then we have different we have different cells that perform different functions in the body, but then your body has actually there's different categories of immunity, and these categories of immunity start off on page 402. So cellular immunity, humoral immunity, and then there's different categories within those. And referred to as natural active immunity, artificial active immunity, natural passive immunity, and artificial passive immunity. These are just ways that we have the ability to fight off whatever it is that's trying to attack us. There's just different ways. So if you look at natural active immunity, it's the production of our own antibodies. You get sick, your body says, oh, I need to create some antibodies to fight off this antigen. And yeah, so in artificial active immunity, this is where, yes, your body is creating its own active immunity, but with the help of us getting an immunization or a vaccination that puts that virus, or that, like, mostly it's viruses, put it into our system so we can learn to fight it off. Natural passive immunity, temporary immunity acquiring antibodies from another. This is mom giving her antibodies to a baby. And again, it says temporary because that typically wanes off by the time that the infant is 6 months old, and then the infant will have to create their own antibodies, and that's how they would get exposed and then learn to fight those things off. And then artificial passive immunity, this is where you'd get injections or infusions of immunoglobulins, and there's different ones based on what it is that you need. All right, so now we're doing a little bit opposite. Give the term based on the provided definition. So what is the term for to administer a preparation to generate active immunity? Vaccinate. The process by which cells or other particles adhere to each other and form clumps. Agglutination. A group of proteins in serum that destroy bacteria and other cells. Complement. And then weaken the ability of an organism to cause a disease, and that's attenuate. You might have heard attenuated vaccines, and that's exactly what it is. They take a very, 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 very tiny amount of the virus. Most of the time, they're dead, so they can't give you the infection. But there are some live vaccines out there, but they're just in and we're talking minuscule, microscopic amounts. Okay, a few other terms you're going to see. Dormant. That's when something is just, you've been exposed, but it's not actively causing any issues in your body. It just hangs out. Incubation. This is the time that it takes for the cell to incubate and then start growing, hatching, kind of like an egg. And then opportunistic. This is where your body's fighting off some other condition, and it could be stress, and then a secondary condition says, ooh, you're not doing so well. I'm going to attack you now as well. Abbreviations. I'm sure everybody's heard of the abbreviations AIDS and HIV, what they stand for: acquired immunodeficiency syndrome and the human immunodeficiency virus. All right, disorders. Tonsillitis. Anybody out there ever had tonsillitis? I have, yes, tonsillitis. See, that if you look at it, we've got 2 L's in the tonsillitis. And then splenomegaly, spleen. And then we have megaly, means enlargement. Lymphedema, swelling of the lymph. And then we have lymphoma, which is a tumor or a mass. And there's 2 different, up here, there's 2 different types that are shown: Hodgkin lymphoma and non-Hodgkin. All right, so we're looking at identifying the suffix of the word. So we can see we have a lymphaden, and lymphangio. So we've got a lymph gland, because aden means gland, and then lymph, angio, it means vessel. So we're looking at ectomy, itis, pathy, and gram. So what do they mean? Ectomy, look it up. You guys should hopefully know this by now. You've probably seen it a couple times. Itis, what does that mean? Pathy, what does that mean? And then gram, what does that mean? All right, we have hypersensitivity. And then these go under allergies, autoimmune disorders, alloimmune disorders. Allo means strange or different, anaphylaxis, and then we have our anaphylactic shock and asthma. Immunity of transplantation. This just has to do with the fact that if you receive a transplanted or like an organ or even like bone marrow from another person, you even though you are they check for same blood type and all that kind of stuff, it's still not yours. And so your body would identify it as foreign and try to fight it off. So you would have to be on um, anti-rejection medications for the life of the time that you actually have that that organ. So just a couple of terms to identify the difference between. So we have alloimmune and autoimmune. We already talked about that on the previous slide. And then immunodeficiency and immunosuppression. Take a look it up, and look at or identify what the difference is between deficiency and then suppression. Viral infections, obviously we have influenza out there, the coronavirus, HIV, and then over here, you see this is Kaposi sarcoma. This is only associated with people who are HIV positive or have AIDS, and it's a type of cancer specific to that disease. All right, diagnostic procedures, immunodiagnostics, lymphangiogram, and immunoassay. Therapeutic procedures and drugs. There. Antiretroviral, cytostatic, cytotoxic, splenectomy, which we already talked about, and tonsillectomy. Macrophage, phagocyte, transplant, immunologist, pathogen, and urticaria. And that is it for chapter 12. I'll be doing, or go to chapter 19 for this week as well. And if you have questions, please let me know.